I do believe we are emerging from this pandemic, but a lot of uncertainty remains. And COVID-19 is going to be with us for the long term.
That includes this fall when BC is going to face a possible twin pandemic of COVID-19 and influenza. During Australia and New Zealand's recent winter, influenza came early, hitting at the exact same time as a surge in Omicron. New modeling shows the same thing is likely here, with influenza beginning as early as November.
We're going to see influenza, I have no doubt, and the worst case, we might start seeing a surge at the same time that our immunity from our last booster doses of COVID is surging as well in November and December.
Projections suggest an additional 700 patients with COVID admitted to hospital this fall on top of the 350 already there. And that could happen at the same time as an expected peak in the flu, with up to 1,200 patients needing hospitalization from that virus. BC residents started getting the bivalent vaccine earlier this month that protects against Omicron, something previous vaccines didn't offer. And as of October 11th, clinics will offer both COVID and flu vaccines at the same time.
The most effective layers of prevention against serious outcomes is staying up to date with your vaccinations.
But the healthcare system is preparing for the worst. The province is prepared to transfer patients from one health region to another via air ambulance if needed, and as a last resort, will postpone surgeries.
We obviously want to avoid that. It's why we have increased surgical capacity so significantly in the pandemic to increase the number of surgeries we do when we don't have other high pressures on the communities.
BC is expecting its first flu vaccines to arrive by the first week of October. Influenza is expected to peak here by January.